while we're waiting for the doctor, there's a form you need to sign. It's just what they call a medical authorization or release.
Do I have to sign that now?
It's just so the railroad can pay your bills. Come on.
I thought my insurance took care of all that.
Technically it does, but, well, most of it. You know, there's always a copay and balance due, and the railroad doesn't pay that unless you sign this form.
What the trainmaster says is probably true, but there is much more to it. Most releases are so broad that the railroad can use them to get more medical information about you than just this injury. At this point, the railroad has no right to any other information. The best thing you can do is tell the trainmaster that you want to think about it and you'll sign it later. If you do sign the medical authorization, write that it applies only to your injury of this particular date. Some railroads have used this overbroad release to allow their medical, claim, and law departments, or even hired medical managers, to contact your doctor directly and be present when you are being treated. Often this results in railroad representatives telling the doctor how to treat you, who to refer you to, and when you should be released for work. Therefore, you must write on the form that you are not waiving your right to doctor-patient confidentiality, and that the release is only good for 30 days. Because all of this can get pretty complicated, we recommend that you not sign the form until you have conferred with us or your union representative.
Nice to meet you, Dad.
Nice to meet you. How you fellas?
We're his supervisors. We drove him down just to make sure everything's okay, check on his well-being, to see how long he's going to be off from work. We have some forms for him to sign just to make sure everything is taken care of.
Well, fine, let's take a look.
Doc, do they have to be here?
They're your employers. I mean, it is workman's comp.
This is a railroad injury, and I'm not covered under workman's comp. And my insurance is going to pay for the cost, so we don't have to worry about that.
Well, you do have a right to patient confidentiality, so if you'd rather, I can ask him to leave.
Yeah, I'd prefer that if it's okay.
You fellas mind?
Okay, Bill, we'll be outside waiting for you.
It's your patient-doctor privilege to be seen by the doctor alone. Ask the trainmaster and company official to leave the room. If you aren't comfortable with that, have the doctor or other hospital staff ask the railroad supervisors to leave. As for your medical bills, the railroad does not pay them. Your insurance company does. At best, the railroad will be the middleman to process the bills. Understand, too, that although at some point you will be required to be examined by a company doctor, it's your right to choose your own treating doctors. The railroad has no right to direct or interfere with your medical treatment. When you do speak to any admitting nurses or doctors, remember it's important to tell them, just as it was on your injury report, exactly what unsafe condition or defective equipment caused your injury. The railroad's negligence that caused your injury must appear on all your medical records. In the scenario being shown here, I fell isn't good enough. Give the details and be completely truthful. Also, concerning your treating doctors, it's important that you educate them as to your specific job duties so that they can correctly determine when or if you'll be able to return to work. Educate your doctors, too, about the type of insurance coverage you have, as more than likely they, too, will be unaware that you are not covered by workers' comp. To help educate your doctors, our firm has job descriptions and explanatory letters to doctors to describe the type of work you do and the kind of insurance you have. Please contact us, and we will send you copies of these documents. These documents are also posted on our webpage.
How did you injure yourself?
Well, I was walking along the tracks, and there was these big rocks. We call it ballast, and I must have stepped on one, and I rolled my ankle and fell to the ground. It was kind of dark, and I couldn't see very well.